Welcome to Excel's new webinar. We are excited to have Dr. John McShane join us to talk about a topic that is near and dear to his heart, tendon problems. Dr. McShane is founder of McShane Sports Medicine in Villanova. He is a specialist in the non-surgical management of musculoskeletal conditions. Dr. McShane also pioneered the use of diagnostic ultrasound in the management of musculoskeletal conditions. And if you've ever been to a sports medicine physician's office, it's more likely you're going to see an ultrasound machine in the office than not see one. So thank you for that advancement, Dr. McShane, and thank you for joining us today.
Well, you're welcome, and thank you for having me.
First off, how are you doing? Is your practice open? What are you doing to help treat your patients these days?
Well, fortunately, we've been able to stay open through all of this. We've scaled back our patient volume quite a bit. We're taking many precautions to keep our patients safe, as well as keeping our staff and ourselves safe as well. We're spacing patients out far enough so that there's rarely any crossing paths of patients, as one is leaving and one is coming. After every patient, well, first of all, when patients come in, we have them sanitize their hands. We remove any extraneous items. We don't want them bringing those things back into the exam rooms with them. Once they're in the room, we're keeping our distance. We're wearing masks. We wear gloves, which get changed after every patient. Once the patient's finished with their office visit and leaves, the room, the waiting room, every place that patient was gets thoroughly cleaned after the patient leaves, so that we're starting fresh before the next patient arrives. And that's a lot of extra effort and time, but it's worth it, and they're the steps that we're taking. So at least we're able to continue to provide care for people and be a resource when people are having pain and need to be seen.
That's great. Yeah, that's we're doing something very similar in our clinics, just the spacing and the distance when people are in there, and the cleaning. That's vitally important right now.
So I will just say that it's important. It's important that the physical therapy clinics and offices like mine, it's important that we're able to be open, because these patients who are in pain or in need of care might otherwise find themselves going to emergency rooms or urgent care centers, and that just adds to the burden of those facilities, which we're trying to minimize, and also increases exposure once you're there as well.
Exactly. Even if during this time, pain doesn't take a day off. It just keeps going at you. So we're happy to be able to provide the safest environment as possible to help the people that that are willing to come out and take advantage of that. So how did you get so interested in tendon problems?
Well, tendon problems are really common. And in the early days of my career, as I was seeing patients with these problems and trying to understand what was the best approach to take to treat them, I learned pretty quickly that some of the strategies that I had been taught and the strategies that were written about in terms of treating these problems really were not that successful. You can take tennis elbow, for example, as a very common condition that people would come and see me for. This is a very painful condition in the elbow. And I would do the things that I had been taught were the right things to do, and I might have been able to provide some temporary relief for people, but then the pain would come back and people would really be debilitated. And so I saw this happening over and over again, and I just thought to myself, there has to be a better answer here. And it became apparent to me that I really needed to understand the problem at a much greater depth than I understood it at that time. And so I took it upon myself to research the the condition and try to understand what we knew about it from a scientific point of view. I dove deep into the medical literature and learned as much as I could about what was actually happening. And really, by doing that and going through that whole process, it entirely changed the way I approach these problems to the point where now we have a very good strategy in place to help people with these conditions.
So what is it? What is the problem that affects or impacts these tendons that cause them to become painful, like in tennis elbow or?
Yes. So, there are tendons all over the body. The rotator cuff is a tendon. There's the Achilles tendon, the tennis elbow, and golfer's elbow. Those are both conditions that affect tendons all over, and all of these tendons can become painful under the right circumstances. They are often referred to as tendinitis, and that unfortunately is not an accurate word to describe the condition. The word tendinitis means inflammation of a tendon. And one really important thing to understand about these conditions is that these tendons are not inflamed. They are painful, but inflammation is a very specific biochemical process that happens. And the process of inflammation is not what is happening in these tendons to make them painful. These tendons are degenerated. They are degenerated, and there is tearing and damage with improper or inadequate healing in these tendons, and that's what leads to the pain. If I can describe it like this, tendons in general are made of these densely packed fibers of collagen that are all run in parallel to each other. You could think about a rope that's made of lots of fibers that are woven together. Mm-hmm. In tennis elbow, for example, or in Achilles tendon problems or the rotator cuff, what's happened is many of the fibers within the tendon have become damaged. And damaged means they've become torn and degenerated. And if you were to look inside of these tendons with a microscope, what you would see are thousands of small microscopic tears, and sometimes not microscopic, but bigger than that, running through the tendon. You could think about a rope that's frayed. So in a rope that's frayed, many of the fibers have torn, but the rope's still attached, still connected and continuous. One difference between a rope and a tendon, however, is that when a rope frays, the fraying begins at the periphery of the rope on the outer side, and it gradually works its way into the core. In a tendon, on the other hand, the process is the exact opposite. The damage is happening in the core of the tendon, not at the periphery. And it's inside of the tendon where the fibers are degenerating and tearing. When this process begins, the body wants to try to heal it. It wants to try to repair the damage. And the way it does that is it starts building new fibers of collagen that are supposed to come in and be precisely laid down in a way that fills in the gaps of these little tears that have happened. But unfortunately, our bodies are not very efficient at doing this. And so what ends up happening is this new collagen that's being built and being laid down gets laid down in a very random and scattered sort of way, and will end up sort of swirling around and surrounding the area of damage instead of filling it in and repairing it. And once it surrounds it, it walls it off. And now that prevents it from healing, because the things that need to get into the core of the tendon cannot get past this sort of thick, dense tissue that's formed around it. And this is the reason that these conditions are so chronic, why they don't go away if you rest for a couple of weeks. Most things, if you sprain your ankle or pull a muscle, very frequently you rest for a few weeks and they get better and you do okay. That does not happen with tendon problems. Tendon problems become really chronic and nagging, and this is the reason why.
Wow, that's fascinating, because you always hear people say, oh, I have tendinitis. I have tendinitis. So it's actually a degeneration in the tendon.
That's right. And if you treat it like it's inflamed rather than degenerated, you won't make it better.
Got it. So say I go out, I have a lot of mulching to do. I'm doing a lot of lifting, and I do that on Sunday. Saturday, I feel pretty good. And then Monday, my elbow's really sore and it just is nagging. Is that a common presentation you might get from someone that develops a tendon or has pain from a tendinopathy?
Yeah, that's a pretty common scenario. The first thing to be said is, unfortunately, I always hate to say this to patients, but age has something to do with this. We don't see these conditions in people that are 20. 20-year-olds don't get tennis elbow. 40-year-olds get tennis elbow. 50-year-olds get it. 60-year-olds, but not when you're 20. And the other hallmark of getting these conditions, it is not doing an activity over a long period of time that causes it. It's doing an activity that you have not done in a while that brings it on. So, for example, you decide on one weekend you're going to clean up your yard, and you're going to do a lot of pulling weeds and using clippers and hedge trimmers and carrying stuff away. And then that's not something you've done for months, let's say. That's a setup for getting this. And I will say that in a condition like tennis elbow, for example, even though it's called tennis elbow, yard work causes more tennis elbow than probably anything that I see. But it is the doing the activity that you have not done in a while, and that's the risk factor.
So I'm a tennis player. I've been playing I'm not, but if I was a tennis player, playing for years, but I go to a new coach and he wants me to try to do a new top spin backhand.
That's right. A new technique or a new volume. You haven't, you've been playing and you play twice a week, and so you have this sort of set amount of backhands that you hit in the course of your playing.
Yep.
But you're not really happy with your backhand, and so you say, well, I'm going to go to a coach and work on this.
Yeah.
And so you go to a coach, and they're having you hit backhand after backhand after backhand after backhand. That's a risk factor.
Got it. Especially if you're 40, 50, 60.
That is right. If you're 40 plus, that's a risk factor right there.
So
even a new racket, even new strings on your racket can be a risk factor. Something new, something you've not done before, whether it's the technique or the volume or the activity itself. If it's something you haven't done, doing it now is what will trigger the problem.
Got it. So it's not an inflammatory problem, but it's painful.
It is.
And so people always they can leave Motrin, that's all readily available, and they take it. Yeah, they might get a little bit of relief, but so if it's not inflammatory, what is the treatment for this?
Well, it turns out, first of all, that the medicines you just referred to, things like Motrin or Advil or Aleve, those medicines are pain relievers, and they may provide some relief of pain, but they definitely do not contribute to the healing of the problem. And in fact, studies show that taking those medicines can actually impede the healing of the problem. So while they give you some short-term pain relief, they definitely don't help towards the long-term cure. In order to cure the problem, you have to go back to what the problem is. And the first thing that has to happen, is you have to stop doing the activity that caused the problem. But from a treatment point of view, the first thing that has to happen is you have to somehow break down or break through this bad collagen that's formed within the tendon so that the tendon opens up in a way that the things that are needed for healing can get into the core of the tendon. Once once you've gone through that process, the next step is to stimulate the body's healing process in a way that gets it to heal correctly instead of incorrectly the way that it has. It won't just do that on its own. It needs a push.
Mm-hmm.
So when I see patients with these conditions, the first thing I think about is, can physical therapy alone cure this problem? And the vast majority of times, the answer to that is yes. But there's a caveat to that. And the caveat, a couple of caveats. Those caveats are, it has to be the right physical therapy, meaning you have to do the right things to the tendon. And it has to last for the right amount of time. There is nothing that will cure this problem quickly. It takes time. And the final thing that patients need to understand is that when they go to physical therapy for these conditions, the therapists need to do things, and they need to ask the patient to do things which are going to make the tendon hurt. As I say, you have to beat it up to get it better. If you don't go through that process, which is not all that pleasant to go through, if you don't go through that, you will not get the problem better, because there is no way to break through that bad stuff that's formed without making it hurt, unfortunately. But if you persevere and push through it, you will get over that hump and then get to the other side where it starts getting better and better as it's healing.
Is there a correlation for what's common tennis elbow? I've had tennis elbow for pain in my elbow in the outside for 4 weeks versus someone that has had it for 4 months. Will that breakthrough period be longer for the 4-month person versus the 4-week person?
Well, the first thing to understand is that before you developed pain, you actually had some damage happening in your tendon for some period of time up to that, and then something pushed it over the edge. So it wasn't completely normal, and then right when you felt pain is when it changed. So no matter how long you've felt it, it's been there for a while before that, and getting it better is going to take time. For me, the question in my mind is, is physical therapy alone going to be enough? If the answer to that is yes, if it turns out that the answer to that is yes, then it doesn't matter if you've had it for 4 weeks or 3 or 4 months. It's probably going to take about the same time to get it better. Now, one of the decision points for me about whether I think physical therapy really has a good chance of getting it better has to do with how long you've had it. Because if you've had it too long, therapy probably is not going to be enough to get it better. And I don't have an exact number of months for that. Most people within 6 months, I think physical therapy has a pretty good chance of getting it better if it's the right therapy and the patient is really diligent with it. Getting beyond 6 months, getting out to a year, then I start thinking something else might need to happen here with these tendons to get it better. But if you're inside of, let's say, that 6-month frame, I think everybody, is going to take about the same amount of time, which is probably going to be about 3 months.
Wow. So I come in having it for 8 months, having a tennis elbow for 8 months, and I've tried some good therapy according to the principles that you've kind of laid out. What are some of my options that you could offer me to help me get past this? Since physical therapy doesn't seem like it's going to help me to get past this pain.
Well, in my practice, if someone is at that point where therapy has either failed to resolve the problem or they look like someone whose condition is just too far gone and therapy probably is not going to be successful. There's a procedure that I do, an office-based procedure that I do, that has a very high success rate of getting this condition to resolve. That procedure involves looking at the tendon, the tendon that we're treating, looking at it under ultrasound. So I can see the tendon and I can see the abnormalities within the tendon. We then take some local anesthetic and we numb the tendon up. And then once it's numb, I go under the skin with a needle as I'm watching on the ultrasound screen, and I guide the needle into the damaged area of the tendon, and I use that needle to go through and break up all this bad abnormal collagen, this abnormal tissue that's formed within the tendon. And when I do that, I'm accomplishing two things. The first thing is I'm opening the tendon up so that now things that need to get into the core of the tendon can actually get there. And the second thing that's happening is I'm creating an injury to that tendon. And that injury is something that the body recognizes that it needs to heal. That process is called stimulating a healing response. And a healing response is when there's any sort of injury in the body, and the body recognizes it and musters all of the things that it uses to repair and sends them down into the tendon, and it begins working on the repair. We then have a physical therapy regimen that we use that guides that healing process so that we get the tendon to heal correctly instead of incorrectly the way that it has. So, and just knowing your protocol, some of those are manual techniques by a therapist in the area that the tendon, isometrics leading to eccentric exercises. And I think we'll actually have one of the therapists from the Villanova office on to talk about some of the treatment protocols that they would use for a non-procedure tennis elbow and a post-procedure tennis elbow, because they're essentially the same with the focus. They're very similar. Yes. Awesome. Any other take-home points that? Yeah, very similar. Any other take-home points that someone would be interested in hearing or knowing about as far as tennis or tendon-related problems? I think one important thing I would say is, well, I think there are two comments I would make. One is, in an effort to try to avoid getting these problems, you want to be conscious and think about any new activity you're doing, and do it in moderation. Do it slowly and gradually build instead of doing it all at one time or very quickly. That's how you can help avoid these problems. The second thing is, the sooner you get in to see the doctor, the more likely it will be that physical therapy will be able to cure the problem, and that you won't need to have any other sort of procedure done to get rid of it. The sooner we can get on it, the quicker it will go away and the less likely it will come back. Awesome. Well, that's great information. Dr. McShane, thank you very much. Just to let everyone know, Excel Physical Therapy has 32 clinics in the Delaware Valley. You know, physical therapists are specialists in the treatment of musculoskeletal conditions to alleviate pain and assist our patients to return to function. Together with physicians like Dr. McShane, we help people return to things that they love to do based on their individual goals. For more information about how the physical therapists at Excel Physical Therapy can help you, please call us at 866-883-9235 or visit us at excelphysicaltherapy.com. For more information on Dr. McShane, you please call his office at 610-254-8001 or visit his website at johnmcshanemd.com. Thanks again, Dr. McShane, and until our next webinar, be safe and keep moving.